I'm Ed Critchley and I'm the Chief Commercial Officer here at AIMES. Here at AIMES, our services include hosting, cloud and associated services such as infrastructure as a service, platform as a service, backup as a service, software as a service and of course co-location and associated network and professional services. In terms of our focus, we engage predominantly in the healthcare sector, both the NHS and organisations that work alongside or within healthcare. Our heritage and our accreditations ensure that we are seen as a trusted partner, and as such many NHS and healthcare bodies rely on AIMES to manage their data, including patient identifiable data. We work with trusts right across the UK, as well as associated academia and research bodies. The reputation that AIMES has developed within the NHS and healthcare sector is one of being a safe haven for hosting patient identifiable data in the cloud. As well as being ISO 27001 accredited, we also meet NHS criteria for information security and governance. This allows us to provision G-Cloud assured services, and as an N3 aggregator, we will help organisations transition across to HSCN.
I'm Dr. Ed Conley. I'm the Chief Scientific Officer at AIMES. For the NHS, it's more about partnering than simply doing for. The partnering process usually starts with quite ordinary discussions with frontline clinicians and leaders in the NHS, trying to understand what the problems and the gaps are. The problem might be that information needs to be shared in a safe or secure manner across different parts of the NHS for patient benefit, or that the information needs to be collated so that doctors can see which treatments work best given all of the evidence. Our current project in the Connected Health Cities programme is developing a model for the NHS to become a learning organisation. In this project, information gathered from the normal daily activities of the NHS can be analysed so that the best actions can be taken that are most likely to give the best patient outcomes.
I'm Professor Mike Pearson. I'm a semi-retired physician, and I've been interested in data for many years, and as part of the Connected Health Cities project, it's been really exciting to team up with AIMES on a joint project to try and make data work. I've been involved in the uses of data, and particularly how data can make medical care more effective. The NHS is awash with data, but very little of it is available to the front line.
The recipe for raising value is about using information to deliver better outcomes for less cost, or it might be about interpreting evidence for the effectiveness of new treatments against the old ones, or it might be about targeting care packages so that they have the biggest beneficial impact.
So this is about collecting data, making something of it, and then sharing it back with the professionals.
Another focus is giving patients a voice by recording and enforcing their information sharing preferences. For example, not everyone necessarily agrees to the reuse of their health data in medical research projects. However, if you give people a simple choice and you adhere to that choice, then that is a minimum safeguard. People also change their mind, and so there needs to be a mechanism to update their preferences, and these are all part of the AIMES solutions. Through projects such as Connected Health Cities, patients can participate in the solution design process and see exactly what is happening with their data.